Hi, my name is Dr. Ron Henry, and welcome to part 3 of the acupuncture meridians. In Chinese diagnosis, they would often ask the patient questions like what season they felt worse in. There being essentially 5 seasons that they related to the 5 elements of Chinese medicine. Basically, there were 4 seasons, the traditional 4 seasons, plus there was a transitional season that they associated with the earth element. The physician would ask at what time of the day patient felt worse, and if they had any type of food cravings or food sensitivities, and also if they had experienced any powerful emotion or continued to feel any strong dominating emotions. Very interestingly, along with symptoms experienced directly in the areas of the organs, these would often combine with symptoms the individual felt in the region of the body that the meridian itself flowed over. For instance, if a person had a condition of the stomach and a disturbance of the associated stomach meridian, since the stomach meridian begins below the eyes and runs over the face, down the throat and chest to the toes, someone with a stomach condition could have sinus problems, or symptoms with the eyes, or the face, or the mouth and teeth. The problem could be originating in the stomach and the stomach meridian, even though the patient's symptoms might be actually felt in the face. Another example might be the gallbladder. The gallbladder meridian begins at the outer corner of the eye. It runs over the head and continues down the neck, over the shoulder, down the side of the body, through the lower back and hips, and finally into the toes. The gallbladder physically can be related to a diet rich in fats and oils, but emotionally to feelings of resentment and anger. If a person experienced pronounced emotions of anger and resentment, these could then affect the flow of their vitality or qi, possibly leading to headaches, for example, since the meridian runs over the side of the head. They could also develop tension in the shoulder and neck area, or in the hips, the mid and lower back, since the meridian runs through all of these regions as well. Therefore, from an emotional state, or from a dietary indiscretion, and of course from physical trauma to the body itself, any of these could affect the gallbladder meridian, and therefore produce symptoms that might never be associated with an internal organ, or with a dietary condition, or with a traumatic injury that affected the course of the meridian. But without treating that meridian, it might be difficult and it might be impossible to actually clear up the physical condition that the individual experienced.